the really exciting things that's come up in the area of fertility medicine over the last 5 years is the use of platelet-rich plasma. Platelet-rich plasma generally is made from the person's own blood, and it contains a whole range of growth factors and chemicals we call cytokines, and we think the role of these in improving the function of the area that the platelet-rich plasma can then be put into is that it activates healing systems within that tissue. Those healing systems can be regenerative cells. It can also have effects in repairing some of the problems that are also going on in the tissue, and there are a number of these that can occur. Now, we've been using platelet-rich plasma in medicine for many decades, and the amount of information that we have around it in regard to its safety is really quite extensive. And we are aware that basically, especially if you're using your own plasma to make the PRP, that it carries very few risks. So from around 2017, I've been undertaking this procedure for women who really have had end-stage ovarian failure, and it's become completely obvious that this process changes how well the ovaries work. This procedure on the web is called ovarian rejuvenation. Personally, I'm not sure that that's the right word to use for it, but that's what everyone now considers ovarian rejuvenation to be. It's about putting platelet-rich plasma into the ovaries. It's a procedure that's done in different ways. It can be done transvaginally and put into the ovaries. It can be done laparoscopically and put into the ovaries. So let's talk about a couple of the things that I've just mentioned. One, end-stage ovarian function. Most of the women I'm currently dealing with have AMH levels below 1, or they no longer have periods, premature ovarian failure, or even menopause itself. For those who aren't aware of AMH is a protein that's made by growing follicles. Follicles that are very small, follicles that aren't responding to the hormones yet that the body makes to help ovaries grow. These hormones, the main one people know of is FSH, which is the medication that's given as part of IVF. These very small follicles aren't responsive to FSH. And as part of their growth process, they make AMH, and we measure that to basically see, as a guide, how many follicles there may be growing in the ovaries at a particular time. The role of PRP we currently see as activating follicles that are dormant and may be difficult to activate. We don't quite understand the mechanism for activating follicles. There are many different factors within the body, growth factors I'm talking about. So these are chemicals that activate different cells at different times. There are many hundreds of these that are intimately involved in getting one follicle to get to the point where it can release an egg. We're looking at using platelet-rich plasma to activate follicles and really push a ball down a hill, and so it gathers speed, and we can continue that process and ideally collect more eggs and get more babies.